Hi, Paul Griffin here, MARTA's Director of Infectious Diseases. The situation with COVID in Australia has certainly continued to evolve rapidly, and therefore our response required has also evolved, and I'd like to give you a brief update today. I've had a lot of questions about why the numbers in Victoria haven't started to fall, and this is a relatively complex answer based on a number of issues that continue to be the case in Victoria. One of them is the level of sustained community transmission, and therefore any intervention to reduce spread will take weeks to see a measurable impact. Also, the transmission in nursing homes and healthcare settings is very difficult to eliminate, even with very harsh community restrictions. And so this too is continuing to fuel the numbers down there. I've been asked if we expect to see a similar situation here in Queensland, and fortunately we've maintained excellent control despite a few recent breaches in our borders and other risks that have been introduced recently. It's really important, however, that we keep doing all the right things to make sure that we don't see ourselves in a situation like Victoria, and the key things really are continue with the hand hygiene, the social distancing, staying home and getting tested if you're unwell, and having the COVID Safe app installed on your mobile device. The ready access to testing has been a big component of our success so far with COVID and is an important requirement moving forward. I'd encourage anybody with any symptoms potentially resembling COVID to get tested, and the important thing thereafter is to stay home in quarantine until you get your results. Testing is a really important part of our control of COVID-19. However, negative tests unfortunately don't exclude exposure to the virus, and sometimes people with negative tests can go on to become positive. It's really important if you are asked to get tested that you do so, and if you have a negative test and your symptoms change, there may be a requirement to have a repeat test, but this should be guided by a doctor or somebody from public health. The wearing of masks has certainly evolved rapidly and remains a little bit of a contentious topic. Certainly in Victoria, it's an important part of their strategy to try and reduce transmission down there. In Queensland, there's little requirement for masks in the community, and the role really remains for people that can't social distance. So for example, people that are travelling or in other situations where they can't apply the other basic principles, particularly social distancing. Masks also are a really important part of our strategy in healthcare settings, so we will continue to use masks appropriately for people that are at risk in hospitals. Here at MARTA, we continue to support the community by having ready access to testing via our COVID-19 testing clinic, which is located at Suite 2, 600 Stanley Street. This clinic is open from 8 till 4. Particularly if you're unwell and need to be seen and get tested, you can still present to our emergency department, but for routine testing, we'd encourage people to look for alternate sites outside these hours via the Queensland Health website. Our testing clinic is happy to see people of all ages, and you don't need to bring anything. If you do have a referral from your GP, please bring this along. There is a lot of misinformation about the testing. It is a very safe and quick process that is mildly uncomfortable when the swab is inserted, but as I say, it's very safe and it's very quick, and it's a really important part of our strategy. So please, if you have any symptoms or anyone says you need to get tested, please make sure you do as quickly as possible and stay home until you get the result. I'd also like to say a big thank you to the community. We've had some potential cases introduced into Queensland in recent times, and if people weren't doing the right thing, we would be finding ourselves right now in a much worse situation. So it's been great that people must have been doing the right thing to keep COVID under control, even with the recent breaches and the issues that we've seen. So thank you.